In this question, we have a 60-year-old woman. She has a history of end-stage renal disease due to polycystic kidney disease. She's had a renal transplantation 2 years ago. She was diagnosed with paroxysmal atrial fibrillation 6 weeks ago. She has had a recent onset of decreased urine output and mild fatigue. Her medications include diltiazem, apixaban, prednisone, tacrolimus, mycophenolate sodium. Her blood pressure is 160/90. Her lab results show increased serum creatinine from her baseline of 1.3 to 2.0. Her urinalysis with microscopy findings shows no CAS. Her blood tacrolimus level is elevated. What is the most likely cause of her worsening renal function? So this patient had a renal transplantation 2 years ago, and as part of her immunosuppression therapy, she was put on tacrolimus. Now, tacrolimus is going to be a drug that is going to be nephrotoxic, and what is important to know is that it is going to be hepatically cleared. So because it is cleared by the liver, if we put patients on a drug that is going to inhibit cytochrome P450, that can increase levels of tacrolimus, so it can then exacerbate the nephrotoxicity of tacrolimus. So this patient was recently diagnosed with atrial fibrillation, and so she was put on diltiazem, and diltiazem is going to be a cytochrome P450 inhibitor. So because it inhibits cytochrome P450, that can then reduce the clearance of tacrolimus, and so as a result, that can then increase the side effect of nephrotoxicity of tacrolimus. And the question tells us that the blood tacrolimus level is elevated, and we know that her nephrotoxicity is bad because her serum creatinine went up from her baseline of 1.3 to 2.0. Now, the reason why tacrolimus is going to be nephrotoxic is going to be because of its vasoconstrictive effects. And so that is also why this patient's blood pressure is elevated because of the vasoconstrictive effects of tacrolimus. Now, in this slide, I have the mechanism of calcineurin inhibitors that include cyclosporin and tacrolimus. So tacrolimus and cyclosporin are both going to work by inhibiting calcineurin, and so this is ultimately going to then decrease the transcription of IL-2, which is going to then not result in the activation of T cells causing immunosuppression. Now, a mnemonic that you can use to remember some of the important associations with cyclosporin and tacrolimus is that I made this silly mnemonic, but you can use it if it helps you to remember stuff. So here I have cycling, a guy that is cycling, and so cyclosporin sounds like cycling sport, so he's cycling, and tacrolimus sounds like a taco. So there's two of them. So that is how you can remember that these two drugs are going to work by inhibiting IL-2, and they're running over a kidney. So this is how also you can remember that both are highly nephrotoxic. And because they're running over the kidney, they're constricting the kidney as they run over. So this is how you can remember that these drugs are going to be having vasoconstrictive effects, and that is going to cause the toxicity that they result in.